On today's show, we're discussing the rapidly expanding menopause treatment market. This is the JAMA Medical News Podcast. I'm News Director Jennifer Abbasi. Associate Managing Editor Kate Schweitzer is here to talk about her story. Kate, thanks for joining.
Thanks, Jen.
It seems that there's been an explosion of interest and treatment options for menopause right now. Why such a shift?
For years after the Women's Health Initiative study was published in 2002, menopause almost disappeared from mainstream medicine. Hormone therapy use plummeted because of concerns about breast cancer and cardiovascular risk. Many clinicians stopped prescribing it, and experts told me menopause education largely vanished from medical training. But today, we're seeing almost the opposite. Social media is filled with menopause influencers. Telehealth companies devoted to menopause care have emerged, and women now have access to an expanding menu of treatments. To some experts, it's an overdue gold rush that's finally bringing attention to a population whose symptoms were often dismissed. But others see it as more of a Wild West, where enthusiasm is moving faster than the science. The reality, of course, is probably somewhere in between. Increased attention is a good thing, but it has also become much harder for patients to separate evidence-based medicine from persuasive marketing.
So what do experts say actually has the strongest data behind it?
That answer was consistent: hormone therapy. Over the past 2 decades, we've gained a more nuanced understanding of those Women's Health Initiative findings. Today, professional societies agree that for healthy women younger than 60 or within 10 years of menopause onset, hormone therapy remains the most effective treatment for vasomotor symptoms like hot flashes. However, hormone therapy is still underused. One recent study found that only 1.7% of women with menopausal symptoms are prescribed it, far below the rates before the Women's Health Initiative. Lingering misconceptions among clinicians seem to keep many women from receiving treatments with the strongest evidence.
You wrote about emergent options like compounded hormones, testosterone, peptides, and supplements. How do these fit into the picture?
That's where the evidence starts to become much more uneven. Take compounded hormones. They're often marketed as personalized or bioidentical, but major medical societies recommend FDA-approved hormone products instead because compounded formulations aren't subject to the same manufacturing standards, and there's little evidence that hormone testing can meaningfully individualize therapy. As you mentioned, testosterone is another area generating enormous excitement. It does have evidence for improving sexual desire in a subset of postmenopausal women, but many are now seeking testosterone to improve energy, memory, muscle mass, or overall vitality. And experts told me the evidence for those benefits simply isn't there. There are also potential adverse effects, including permanent voice changes and hair loss. Supplements may be the biggest category of all, and also the one with the largest knowledge gap. Some, like calcium and vitamin D, have some evidence, while others have little or no data.
Kate, the internet seems to be playing a huge role in all of this. What did experts tell you about the influence of online advice?
Social media is impossible to ignore. Women today often arrive at appointments after spending hours on TikTok, Instagram, or even ChatGPT. It's a tricky balance. Social media can raise awareness, but it can't determine whether a particular therapy is appropriate for an individual patient. And telehealth has become another major force in menopause care. Many women live in what experts call menopause care deserts, where it's difficult to find clinicians with meaningful expertise. Some telehealth startups are helping to fill that gap.
So how should women and their clinicians navigate this rapidly changing landscape?
A big takeaway is that this is actually a very hopeful moment. Women have more choices than ever before, and that's unquestionably progress. But experts also emphasize that enthusiasm shouldn't replace evidence. The best supported treatments remain underused, while less studied therapies receive outsized attention online. One expert told me the goal isn't to discourage women from asking questions or exploring new therapies. It's to make sure those conversations happen with someone who can put the evidence into context and tailor treatment to that individual.
Thanks, Kate. All right, if you'd like to learn more, we'll include a link to Kate's story in the show description. This week, we also published an article on new research on opioid prescribing, 10 years after the CDC published controversial guidelines. You can find that and all of our stories at jamamedicalnews.com. Thanks to Kate Schweitzer for joining me. I'm Jennifer Abbasi for JAMA Medical News. This episode was produced by Daniel Morrow at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening and join us again next week.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.